Today, I will be presenting on vestibular function in the home care setting and how it impacts occupational therapy practice, particularly in relation to balance, safety, and daily function. Vestibular deficits often present subtly, and patients may not directly report dizziness. Instead, they may describe feeling off, unsteady, or less confident with movement. Other complaints may include blurry or double vision, lightheadedness when standing, or decreased sensation in the feet. These symptoms can significantly impact ADL performance, leading to slower movement, increased reliance on environmental supports, and reduced participation. Balance is dependent on three systems working together: vestibular, visual, and somatosensory. The brain constantly determines which system is most reliable and adjusts accordingly. For example, in low-light environments, reliance shifts towards vestibular and somatosensory input. With aging, all three systems decline. There is reduced vestibular function, slower nerve conduction, decreased proprioception, and visual impairments. This makes compensation less efficient and increases fall risk, especially in complex or changing environments. When looking specifically at the vestibular system, patients may report dizziness with position changes, spinning sensations, or motion sensitivity. Functionally, this may present as hesitation with head movement, stopping before turning, or avoiding certain movements altogether. Assessments such as the head thrust test and the dizziness handicap inventory can help identify vestibular involvement, and I'll go more in depth with those on a later slide. Intervention may include gradual exposure to movement, task modification, and gaze stabilization exercises, which will also be discussed further in the VOR section. The visual system often becomes a primary compensatory strategy when other systems are impaired. Patients may report blurry or double vision, especially during movement, or increased difficulty in low-light environments. Clinically, this may present as increased visual scanning, slower navigation, or hesitation in cluttered spaces. Screening may include ocular motor testing and functional assessments such as the functional gait assessment. Intervention focuses on improving lighting, reducing visual clutter, and using visual anchors to support stability. Now, the somatosensory system provides critical feedback about body position and contact with the environment. When impaired, patients may report numbness, tingling, or difficulty feeling the ground beneath them. This often leads to increased reliance on vision and external supports. Assessment may include proprioceptive testing and functional balance tests. Intervention may focus on surface training, sensory input strategies, and ensuring appropriate footwear to improve stability and safety. Now, before initiating vestibular-based interventions, it's important to screen for other potential causes of symptoms. Orthostatic hypotension should be assessed by measuring blood pressure, first from supine to sitting, then to standing, and monitoring for symptomatic drops. Also, it's important to consider possible vascular causes. If appropriate, the carotid artery can be listened to with a stethoscope, and a whooshing sound may indicate something abnormal. If symptoms come on suddenly or don't seem related to movement, that may be a sign that further medical evaluation is needed. A combination of subjective and objective assessments can be used in the home care setting to better understand how vestibular impairments are impacting function. The Dizziness Handicap Inventory is a patient-reported outcome measure that captures how dizziness affects their daily life. As shown here, the scale includes questions like, does looking up make your dizziness worse? Do you feel dizzy when walking through a grocery store? Or does turning over in bed trigger any symptoms? It also looks at how those symptoms are impacting the person in their daily life. Each response is scored, and then the scores are added up for a total. A higher score means that person is experiencing a greater impact on their daily functioning. This is helpful because it gives us a better understanding of how dizziness is affecting participation, even if we don't always see it directly during a session. The head thrust test is a quick bedside screen used to assess vestibular function. The patient focuses on a fixed target, such as the clinician's nose, while the head is moved quickly to one side. If the eyes are unable to stay on the target and require a corrective movement, This may indicate vestibular hypofunction on that side. The functional gait assessment evaluates dynamic balance during functional mobility. As shown here, it includes tasks such as walking with head turns, changes in speeds, and navigating obstacles. Each item is scored from 0 to 3, with lower scores indicating greater impairment. This helps identify balance deficits that may not be evident during more static testing and is especially useful for assessing fall risk in real-world situations. These tools are efficient, can be performed within the home environment, and provide valuable insight into both perceived and observed balance impairments. A type of therapy that occupational therapists can perform is the VOR therapy. The vestibular ocular reflex, or VOR, stabilizes vision during head movement. When impaired, patients may experience blurred vision, dizziness, or difficulty maintaining focus while moving. This can lead to hesitation or avoidance of movement. Interventions such as VOR times 1, VOR times 2, and VOR cancellation exercises are commonly used to improve this function and can be progressed based on tolerance. Here are some videos to help explain how to perform each intervention.
So our first exercise is the vestibular ocular reflex times 1, otherwise known as VOR times 1. And remember, we're going to start this by doing it seated. You're going to take a pen and hold it right here in front of you, semi-close, and you're going to take your head and start moving it side to side, keeping your gaze on the pen. Remember, the goal is to go as fast as you can without blurring your vision. So we're going to go ahead and increase the speed side to side, keeping our gaze on that pen. The goal is to get to 120 to 240 per minute. And then we can go ahead and take this up and down as well. So starting off slow, just seeing where your speed is at, and then gently moving in a faster motion, just nice and gentle, small movements, keeping that gaze and tempo steady. As your balance improves, one should add standing and walking while doing these same exercises. It is recommended that you get 20 minutes of walking starting slow and working up to your normal pace of walking while adding the hand and eye motions already described. For the VOR times 2, we're going to bring back our pen, and this time our pen is going to go in one direction and our head's going to go in the other, but we're going to keep focus on the pen. So other. So we're going in the exact opposite direction. It's not a big movement. Just take the time to practice this side to side and then see if you can't go faster and smoother, again without blurring the vision. Next, we have the VOR cancellation, vestibular ocular reflex cancellation. We're going to take our finger like this and follow it with our head about 30 degrees side to side. Again, we're doing this for 20 seconds. And you can also do this the opposite way if you'd like to try. So instead of turning your head side to side with the finger, you're going to turn your head in the opposite direction that the finger is going, still looking at the finger as you go. Try that out for 20 seconds as well.
Okay, in addition to traditional interventions, there are several practical supports that can be incorporated to address specific balance and sensory deficits in the home. For patients with decreased somatosensory input, such as neuropathy, textured mats can provide increased feedback through the feet and improve awareness of positioning during standing tasks. Proper footwear, including diabetic shoes and inserts, can also improve stability and protect against skin breakdown. These are often covered by Medicare, Medicaid, and most private insurance plans. For patients with visual or vestibular sensitivity, sunglasses or tinted lenses can help reduce light sensitivity and improve comfort during mobility, particularly in brighter environments. Vibration tools or handheld massagers may be used to provide additional sensory input, which can help increase awareness in areas with reduced sensation. These supports are typically low cost and accessible and can be obtained through local suppliers such as Sheridan Surgical, community loan closets like St. Matthew's, or online platforms such as Amazon. Incorporating these types of tools can help bridge the gap between clinical intervention and functional carryover within the home environment. In summary, vestibular-related impairments are often underreported and may present through subtle changes in movement and behavior. Observation plays a critical role, as patients may not always verbalize their symptoms directly. Identifying these patterns early and implementing appropriate interventions and adaptations can significantly improve safety, reduce fall risk, and support independence in the home. Thank you for listening, and here are the references used for this presentation.